Now taking a look at the COVID-19 vaccine. The Rhode Island Department of Health releasing plans for if and when there is one. The CDC has set a deadline of November 1st for each state to submit their plans for how they will distribute the vaccine. 12 News reporter Brittany Schaefer spoke to the Department of Health. She joins us with how long this process has been in the works.
Well, the Rhode Island Department of Health says they've been working on this plan for months. The 51-page draft explains who would get the vaccine first and how and where it would be administered. 7 months after the pandemic began, the Rhode Island Department of Health releases their initial plan for vaccine distribution.
We do envision having community place-based sites where people would go and get vaccinated. Usually what we try to do is make it as convenient and as accessible as possible.
According to the plan, the vaccine would be rolled out in phases to select populations. High-risk healthcare workers and first responders would be first on the list. Then over time, the next group would include people with serious health conditions, K-12 teachers, and critical workers in high-risk settings. The final phase of distribution would prioritize young adults, children, and workers in industries that are critical to society.
There are just so many unknowns at this point. We don't know when we're going to get vaccine. We don't know how much vaccine we're going to get. There's talk about there are certain vaccines that would require 2 doses versus 1. So there's just a lot of different contingencies. And that's why what we're trying to do is just be prepared for all scenarios.
Massachusetts also unveiling their initial vaccine distribution plan. According to the plan, they expect to receive between 20 and 60,000 doses of the vaccine in phase 1. Similarly to Rhode Island, the Bay State will prioritize healthcare workers and people considered high risk. Phase 2 will include people of color and lower income communities who have seen higher rates of the virus. In the last phase, when there are enough shots for all residents, the Baker administration says they plan on getting everyone vaccinated quickly and for free. As for when a vaccine could become available, Wendelken says it's still likely a few months away. He says if the current plan changes, they are prepared. I'm Brittany Schaefer, 12 News.